Hi, I'm Julie Kirkland, and in this video I'm going to be showing you how to remove a canine from a top patient. So the first thing is I'm going to approach with a leash just for safety while we're moving through the hospital. I'm going to open the door and greet the patient, let him come up to me. Hi buddy, you're a good boy. Let him smell me, and then I'm going to gently slip the slippery right over his neck. From here, I want to grab his little hip and bring it closer to me, so that it's protected on his spine. I'm gonna give his head a gentle hold here and his feet a back support and gently bring him right to me. I'm supporting his back feet and his head so he can't turn. Thank you very much. Julie Kirkland. In this video, I'm gonna be lifting a 40 to 49 pound dog here. So the safest way to do it, I'm gonna bring my right hand right under her abdomen just to support her, and I have my left hand here just in case she were to get nervous and move her head around, and we're gonna lift gently. Just like that, bending from my knees, not my back, and then I can set her right here on the table for the doctor to do an exam and so forth. And that's it. Thank you. I'm Julie Kirkland, and in this video I'm going to be presenting Canine Restraint, and we're going to be doing a sternal position for this doggy who's already in a seated position. So the next step is I'm just taking his front legs and helping him lay nice and flat forward. So his chest is on the table, and now we can work in different positions and different handling techniques for what we need to get done for our treatments. Thank you. I'm Julie Kirkland, and in this video we are going to be presenting continuing canine restraint, and in this video specifically we're going to be doing a lateral restraint example. So I've got my dog standing here. I am reaching to my left front leg, gently rolling his spine against my body and holding the back legs, and now my left forearm helps control that head so there's no extra general movement, and then we can position our dog as we need to in this position. Thank you, puppy. I'm Julie Kirkland, and in this video I'm going to be applying a nylon muzzle and a gauze muzzle to our canine patient. So for the nylon muzzle, I've gone ahead and fitted it around our neck, so I already know their size. I'm just going to fit it loosely right here on our muzzle and then snap the closure right behind the ears. And now we can have access, our doggy can breathe and see through everything like that. And then I'm just going to remove that. Good job, Bobo, you did so good. And then for the nylon muzzle example, I'm just going to start with a piece of, I'm going to start with a piece of our string, a gauze muzzle, excuse me. I'm going to tie it in a loose knot, and this is going to fit right around our snout, just like so. Good job, babe. And then we're going to gently tie right behind our ears, and then we have an extra protection of a gauze muzzle, just like that. And I'm going to just loosely remove it, untie it. Good job, babe. You did so good, Carly. There you go. And those are how you apply muzzles to canine patients. Hi, I'm Julie Kirkland. In this video, I'm going to be demonstrating how to use a rabies restraint pole on a patient. This patient here is obliged to be our sweet little individuals that we're going to do the example on today. Hi, honey bunny. Normally, they're probably not going to be this nice when you go to use a restraint pole, and that's why we're using the restraint pole. But in this case, I have the hoop nice and loose, so I just gently, hi boo-boo, slide it over our patient's head, just like a lasso. Good job. And then gently tighten it by pulling back on the back side of the pole, and then that way I can maneuver the patient around if we need at a safe distance. And then to release, I just give a little push backwards, loosen the lasso, and slide her head right back off. And that's it. And we're gonna give her a treat now because she did so good. Thanks, honey buns. Good girl. Thank you. You did so good. I'm Julie Kirkland. In this video, we are going to be giving our little doggy here an e-collar and some kisses. Hi, honey. So I'm just gonna fit it right over our snout, behind our ears. Make sure I can fit 2 fingers in between. So far, so good. I'm gonna give it a nice tie. You're doing so good. Okay, I'm fitting it. Yep, I can get enough fingers through there so I know it's not too tight. And there we have it. We have enough space between the edge of the collar so we can't turn around and lick or harm our little catheters or incision sites, things like that. And that's all we have to do for an e-collar. Thank you.